Hi everyone, and welcome to another episode of the Afya Health and Lifestyle interview series from the Agbari Multimedia company. If you're a first-time viewer, thanks for stopping by. It's great to have you here, and welcome to the Agbari channel. And to our returning subscribers, it's always a pleasure to have you guys join me. And don't forget to like, subscribe, share, and if you have questions, you can just put them in the comment sections and we'll have them answered. Now, for those of you that may be new to this, to Afya, I'll quickly run you by the mission. Our mission at Afya is to provide you with life-saving information at the tip of your finger. And how we plan to do this is we invite well-grounded health specialists to educate you on certain medical conditions, and their causes, their symptoms, their management, their prevention. And they will also be helping us shed more light on the prevention, on the myths and misconceptions surrounding some of these medical conditions. Now, on today's episode of the show, we're going to be talking about the COVID-19 pandemic. Our guest today is going to be helping us shed more light on it for some of us who may not know. And he's going to be helping us debunk some of the myths we must have heard about COVID-19, helping us set facts straight, and helping us, it will provide us with tips to keep safe during this period. And before I invite him, I would like to introduce him first. Dr. Oladapo Asiyanbi earned his medical degree, MBBS, from the University of Lagos and proceeded to bag a diploma in tropical medicine and hygiene and public health from the Liverpool School of Tropical Medicine. Over the past 15 years, Dr. Oladapo has served as the medical officer of health at the Lagos State Primary Healthcare Board till date, and he currently practices as the medical director of the Medical Center. He is an active member of the UK Royal Society of Tropical Medicine and Hygiene, Association of Public Health Physicians of Nigeria, the Health Reform Foundation of Nigeria, the Junior Chamber International, and the Nigerian Medical Association. Outside his medical practice, Dr. Oladapo's other areas of expertise include sustainable development, project management, budgeting, strategic planning, emergency disaster management, relationship management, leadership, and IT. Yeah, hi, good morning, sir.
It's still morning. Okay. Good morning, everybody.
Yes.
I'm glad
It's
to be
great
here.
to have you on the show. Thank you for obliging our. Yes, thank you for obliging our.
You're welcome.
So without further ado, let's get to the question, the topic for today. We're talking about COVID-19 and the global pandemic.
Okay.
Anyway, everybody already knows that part. But first off, before we go into the deep part, I would like you to just help us, like a basic introduction or a basic for someone who might be new. I don't know there's anybody new, but a basic introduction into what the COVID-19 virus, what it is, how it works, how it spreads, and the symptoms it manifests.
Okay.
Yes,
Well,
sir.
COVID-19, like the name implies, means coronavirus that was first discovered in year 2019. That's just what that COVID-19 means. Coronavirus disease that started in year 2019. And that name was chosen so that the whole world could adopt a uniform name. And so we all knew that this disease was first reported from China, but now it's worldwide. And so that's why you hear people say pandemic. Pandemics mean an epidemic that is happening in many countries at the same time. Finish. That's all there is to it. So an outbreak of COVID-19 happening worldwide means pandemic. Now, how does this work? It's a virus. It belongs to the flu virus family, but it is new. But it shares a lot of characteristics with the older flu virus, coronavirus that we know. So there are many coronaviruses. There are over like 44. So they share, it's like children of the same great-great-grandparents. They will
Okay.
share some bloodline. So all of them belong to coronavirus. But COVID-19 is one of the many coronaviruses. Quite a lot of them don't even affect human, but some affect human. But all of them, they share the same gene. And that's why the development of the vaccine was quick, because they already knew part of it from all the other coronaviruses that scientists already knew. So they shared similarities. So that made it easier and faster to develop vaccine, not that they cut corners. So that's that. Now,
Okay.
how does it spread? It spreads, it's in the air, and so it spreads through droplets. That means when we talk and we breathe, we have small drops of spit flying in the air. So anybody who has coronavirus is talking and singing or breathing, breathe it out into the air. Now, if you are within 2 meters of that air, because that spit or that droplet will drop and it can travel a maximum of 1.5 meters. So you hear government say, please stay more than 2 meters so that it will be more than the 1.5. So if somebody has corona, now, like I said, spitting and talking. So meaning if you wear a face mask, you can only spit and breathe into that face mask. So majority of your infected spit will be in that face mask. That's why we say you should use face mask. So if you breathe it in, it will grow in your throat and then find a house inside your lungs. That's why if they are taking the test, they will put a stick into your nose and swab, because that's the first place to first leave. Then it will go and settle in your lung and then spread around your body, and then you become ill. Now, because it's in your throat and your lungs, the symptoms are clear. You have cough, because it's an infective agent. You have fever, you have sore throat, you have difficulty in breathing because it's finding the final place in your lungs. And then after that, it spreads to all the other parts of the body. After a time, you stop breathing well because it has filled your lung and water will fill that place. And because you cannot breathe well, people may die. So that's basically what happens. That's the way it is spread. That's the way that it grows in your body. And that's the way people tend to manifest. Of course, it's not only the lungs. After it spreads, it can go to your heart, it can go to your kidney, it can go to your eating digestive tract. It can go to your brain. So if we follow what I've said, it will tell you why we are taking some precaution we are asked to take. Like wash your hand. Oftentimes when you talk, you easily do like this, touch your nose, touch your mouth. So you'd have infected your hand in coat with the germs. And when you touch a door handle or any table, so that's why you say, just keep washing your hand. And don't stay close to someone that is ill. Stay 2 meters away. Now that 2 meters away, when it comes to a lot of people, that's why government will say, please don't gather more than 30 or 50. Because the chances are that some people, when they catch it, after some, while they have the virus in them, they will not show symptoms. Because seemingly their immune system is strong than others. And others will be sick. It doesn't mean that if you are well, you don't have the virus. You only know you have the virus when you go and do a test. Thank you very much. I think that should explain the basics about COVID-19.
Yes, it does. Yes, it does. So you really shed light on the disease and how it works and vaccination. So my next question, picking on the vaccination. So you mentioned that it was that quick because even before the pandemic, there were already strains that the scientific community was familiar with. So it's just so they had like some background things to work with towards cultivating the vaccine. So my next question is, how does this vaccine work exactly? The vaccination, how does it work? And does getting the vaccine mean you're totally immune from getting COVID-19 again?
Well, like I already said, it's not strain, it's different families. Yeah, can you hear me?
Okay, right. Different family. Yes,
Can you hear me?
different family. Yes, I can.
Can you hear me?
Yes, I can, sir. Yes, I can.
Is it better now?
Yes,
Okay,
it
good.
is.
So, all right. So people will call them strain. No, this is not strain. This is family.
Okay.
So great-great-grandfather name is coronavirus generally. So they are different. So it gives birth to different children. So they are coronavirus, but they are different. Now, but because it's the same father, they have common gene. But as time goes, of course, they separate. But so knowing that it has brothers and sisters, which are other coronaviruses, they share the same type of gene. So already between 60 to 80% of the gene in COVID-19, it shares with the other coronaviruses. And so in trying to develop a vaccine, you already have an idea of all the gene that you have. Now for the COVID vaccine, the vaccines are administered by injection. And when they are administered, they teach your immune system how to fight the COVID-19 virus. So what is taking is maybe part of the virus, they inject into you
Okay.
and your immune system will fight that part and then learn how to, so that when the real COVID now comes, it will be able to fight. That's basically what it does.
Okay. Okay. Thank you very much for that, sir. Okay. So the next part of this interview,
That's
we're
the
going
way the
to
vaccine works.
Okay, thank you for that, sir. So yeah, the next part of this interview, we're going to be going into a myth session, debunking myths. So I have a list of myths or a list of misconceptions that people have. So I'll read it out to you, and
You're
you help us
welcome.
verify if it's yes, and you help us verify if it's true or not.
Okay.
So the first
Okay.
question we have is, um, so would everybody that
All
has
right. I'm
COVID, anybody
listening.
that gets, okay, yes. So everybody, if would everybody that contracts COVID or that gets COVID, would everybody get sick? Would everybody that contracts COVID get sick? Basically,
No,
okay,
majority will not be ill.
okay, okay. So my next question would be: is it possible to have a negative test result, and you have COVID, but you tested negative? Like, is that possible? Negative. Maybe if you go for you've been exposed to someone, so you go
Yes.
for test the next day, and then you test negative. But
Oh, yes, 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 yes. It's possible.
oh, okay, yeah, because
And then
I saw something
usually
like
it can, even if you get it today, it's not likely going to show up on that test today.
oh, okay, exactly. Okay, so at what, like, how many days after suspected exposure should someone go and get tested, just to be extra sure?
Ah, now anytime you're exposed, just go and test yourself.
Oh,
Now that we are what we call community transmission, meaning you don't even know who has it, and now majority of people will not have any illness. They will not have the cough, the headache, the fever, but they will have COVID,
okay.
and they
Hmm.
would have spread it to other people. So them and those other people should just go and test.
Okay, okay, thank you for that. So, okay, the next is, does it only affect old people? Because this,
No,
uh,
COVID
okay,
affects, COVID infects. That COVID can spread to everybody.
in fact,
In the beginning, it used to have more bad effects on elderly, but now with new variants coming up, even the younger ones are not doing too well.
okay, so whether you're young or old, being young does not mean you're totally immune from it. Are anti-malarial drugs effective against COVID-19?
Anti-malaria are not effective. Anti-malaria are not effective against COVID because there are two different types of organism.
Okay.
Malaria is caused by a parasite called malaria is a plasmodium and is carried by mosquitoes. COVID is caused by a virus. It's not carried by a mosquito. It's just spread from person to person. There is nothing in
Okay.
between. So there are
Okay.
two different organisms, and so they don't have the same drugs.
Okay. Okay. Thank you for that, sir. Okay. So the next statement is, can COVID-19 be passed on in sunny weather? Some people are of this opinion that it's because it's in cold areas, people that put on AC and stuff like that. That's where the virus thrives. So if you're exposed to sun, if you go in sunny areas, so it's less likely that the virus is there. Things like that. So does temperature, does warm sunny weather, or does exposing yourself to sun prevent you from getting COVID?
Okay.
From getting
No,
COVID.
the sun does not reduce COVID or COVID effects. If that were so,
Mm-hmm.
people in the desert will not have COVID. People
True.
in India also will not have COVID, and people in California, Florida will not have COVID. These are very sunny areas, but people are dying of COVID there. So that would tell us
Okay.
that the sun does not have any reducing effect on COVID.
Mm, sure. Okay. So the next statement to be verifying is, if you've had COVID before, do you still need to get vaccinated?
Yes, you still need to get vaccinated because immediately you have COVID,
Mm-hmm.
the your immune system fights it. However, that thing doesn't
Okay.
stay forever.
Hmm.
So it will just go down, and within another time, you are back to the level you were before.
Oh,
So
okay.
you can still get COVID,
Hmm.
even if you have had COVID before. Therefore, you should get vaccinated to
Oh,
reduce the risk of you dying or
mhm.
getting sick from COVID.
Oh, okay. 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 Thank you very much for that. And so the next question is, so usually there's this, so using hand sanitizer, we know that using hand sanitizers help with um, cleaning your hands and ridding your hands of the COVID-19, the virus,
Of James.
of germs and yes, sanitizing. And it's usually alcohol-based sanitizers and that. And so some people have, I don't know, some people took it upon themselves and took that further. So if putting alcohol, if using alcohol sanitizers is going to help us clean our hands, why don't we just drink alcohol to clean our insides? So some people think you hear people say things like
Yeah,
drinking alcohol will help you kill the COVID-19 inside you.
yes, 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 yes.
So can drink.
Unfortunately,
Mm-hmm, mm-hmm,
yes, unfortunately, when you drink the alcohol,
mm-hmm,
it goes down into your throat and into your stomach, right?
mm-hmm. Yes,
That's where the alcohol goes. But COVID, like I said before, it will go into your nose,
your
into
lungs.
your lungs. So there are two different places. So stomach, so the alcohol will go to your stomach, COVID will go to your lung. So there is no way the alcohol can act on the lungs.
Yeah,
So
true.
it's not useful. That's all.
Okay. Okay, then. Okay, so we have then my next myth will be we have people claim they have like home remedies where you can say okay you have COVID, just use this eucalyptus oil or some sort of oil, just use it to steam your face, things like using vitamin C, vitamin D will help you prevent it. Steaming your face with yes. Do those really home remedies and cures can they help? Can they cure and protect against COVID-19 infection?
No home remedy or any drug has been shown to be effective against COVID-19.
Hmm.
Uh, some of them, there are situation where it was not very bad before, and
Okay.
so it will look as if that's what helped them. I'm sure
Okay.
we've also heard of the one of garlic and all that. There are some
Yes.
parts of
Yes.
this world that they eat. In fact, if you go near them, you smell garlic.
Hmm.
But in that part of the world, people are dying of COVID. I'm sure you know of the country I'm talking about. They
Yes.
eat garlic a lot, but COVID is killing them. So that will show you that it doesn't work. No drug has been known to prevent COVID or treat it the
Okay.
way we use drug to treat malaria for now.
Hmm. Okay. Okay. Thank you for that, sir.
Even
Then
the
also.
inhalation of this thing, it doesn't cure COVID. What it does is it opens
Okay.
your lungs up if it is mild so you can breathe. But if it's severe
Okay.
form of COVID, it will not nothing, you will not get better.
Hmm. Okay. Okay. Thank you for helping us shed light on that, sir. Okay. So now the next myth will be some people have the opinion that in some cases we see that most people, or a good number of people that die, some people say that okay, it's not the COVID that killed them, it's the underlying conditions they had. So if you don't have any underlying condition, it's unlikely that COVID would kill you. How true is that?
That's a high probability that is true. If you don't have underlying condition, it's not that COVID, it's not likely that COVID will kill you. Why?
Or
If you have underlying condition, that means your body is compromised already, and it's likely your immune system is compromised. Now,
okay.
if you now catch COVID, that means COVID is going to come into somebody's system that has compromised immunity or
Mm-hmm.
compromised state of health. It's two things, and therefore it makes
Okay.
it worse. And so the
Mm.
chances of dying is now increased. That's just
Okay.
it.
Okay. Okay. I think that helps us paint more light on it. Then, okay, one last miss. One time, I came across an article that was saying, um, having had COVID, or if you had COVID and then you got treated, and past COVID patients have a higher predisposition to having other medical conditions, like I saw like stroke. People that have had COVID are at a higher risk of developing stroke and maybe some other medical conditions. Yes, how true is that?
It's true because
Okay.
those things are also pre-existing conditions,
Okay.
and also COVID can bring about some conditions like you have spoken about.
Mm-hmm. Okay. So that means that's to say that if you've
It's
had
not
COVID.
that COVID is the thing that causes stroke, but COVID can precipitate something similar.
Okay. Okay. Okay, so thank you for that, sir. So, I think we've gotten that's all the myths I have for now. So, I would want you. We've gotten to we're nearing the end of this episode, and you've covered a lot. You've
Interview,
helped.
okay?
Yes, you've covered. You've touched on how the infection works, how the vaccination works, symptoms. You touched on how some people might not even manifest symptoms and be spreading the virus without knowing. We touched on some of the myths surrounding the COVID-19 infection, and we've helped debunk them. So before we go, I would like you to give the audience a closing message, like a closing, yes, closing feedback on what things that they should take to heart in this COVID-19, in this area as regard COVID-19. We know that these times we see that I feel like people's the awareness is not reducing, but people's sensitivity to it is reducing. Now you rarely see people don't wear face masks as seriously or as frequently as they used to. People are getting lax in this as regards the preventive measures. So what can you give the audience, our audience, a message to help them reiterate the fact that the COVID-19 infection is still out there, and they should keep safe. Basically, a take-home message for them on COVID-19.
All right. Well, my message to them is COVID is here to stay for a long time. We'll now have to adjust our lifestyle to keep safe within the time of COVID. For example, we know that vaccines work to prevent sickness and death from COVID. Vaccines
Okay.
do not fully prevent you from catching COVID. You know, the vaccine is given as an injection in your hand, so it does not replace your face mask. It does not replace your hand wash. It does not tell you not to go near people or not. So if you take the vaccine and you still do those things, you will still catch COVID. Now,
Okay.
if you catch COVID, that means you can spread COVID. If you are vaccinated and you are not ill, but you can still spread COVID, that means you can be what we call the natural bullet or chemical weapon to a biological weapon to another person. So if I'm vaccinated, but I'm still misbehaving, I will catch COVID.
Okay.
I will not fall ill. I will not die. But I will not be a weapon to spread COVID to somebody who has not been vaccinated, who may likely fall ill and die. So
Okay.
it's about still keeping to those safety measures so that even
Mm-hmm.
if you are vaccinated or not, you will not be a reason why to spread COVID. And then
Okay.
everybody will be safe as long as possible. Two, please, if you have information or if you
Mm-hmm.
see information that you are not sure of, please confirm from a source that is credible.
Mm-hmm.
Anything, whether it's COVID or anything else, please confirm from someone that is credible so they can guide you and explain it to you.
Oh, okay.
And like we all know, we all say health is wealth.
Yes, it
So
is.
please try and get wealthy by remaining healthy. Thank you.
Okay. Yeah. Thank you very much for that, sir. Thank you very much. Yes, touching on quickly, touching on you said something about verifying facts and claims you heard, and somehow incidentally, I remember that I came across something this morning about how taking diclofenac. I don't know if you'll be able to help us shed just a bit light on it. How taking
Yes,
diclofenac after getting vaccinated is a no-no. I think it was saying something like it causes death or something. I don't know if there's any truth in
that's
this
not
claim.
true. It's not true. That is not true. That's nothing to do with that. People just whip up some funny information and tie unrelated facts together.
Exactly.
And so please don't don't take diclofenac if you take COVID vaccine, or don't do anesthesia if you have taken COVID vaccine. No, it's not true. Please
Okay.
verify information from the right sources.
Exactly. Exactly. Very verify your information in case
However, please use drugs responsibly only after prescription and follow that prescription.
okay. Okay. Thank you very much for the take-home message and for your expertise. I feel like I have learned so much, and the audience should have learned as much as well. So thank you for taking out time to come and educate us on the pandemic. So it's great. It was a pleasure having you here.
Thank you, Mr. Shitu and Afya Health and Lifestyle. I'm glad to be here, and please stay safe, everyone.
Yes.
Good luck to all of us.
Yes. Good luck. Okay. Yes. And to our viewers out there, I hope you were able to gain as much insight and information as I was. I hope you've learned some of the things, how it works, how the vaccine works, and you've had some of the myths or misconceptions you heard. You had them debunked. Remember that COVID-19 is still out there, and as Dr. Oladapo said, it's probably here to stay. It's going to stay a long while. So stay safe, social distance, wear your face mask, use your hand sanitizers, and be wary of the information you get off of social media, off of your WhatsApp doctors. You just see people just um, anybody can just type any broadcast and then send it out there. A doctor in Hong Kong this said this. Just be careful of all of these claims and facts, and be sure to check in with a professional before you circulate them. Again, stay safe, stay healthy. Till we see again next time, I remain your host, Kehinde Shitu, and have a wonderful week ahead.